I'm not very fond of, but I'll agree to here, which is so-called smart drugs or nootropics. It also covers caffeine, which, again, as I mentioned earlier, increases dopamine, norepinephrine, and to some extent serotonin. But what I like about this review so much is that in putting these drugs of abuse, methamphetamine and cocaine, right alongside these drugs like Ritalin and Adderall and also caffeine, we start to realize that the distinction between drugs of abuse and the distinction between drugs of treatment is actually a very fine and sometimes even a blurry line. And in thinking about whether or not one wants to use these prescription, I want to emphasize prescription, not drugs of abuse, but prescription drugs for treatment of one's own attentional capacity, I think it is important to understand the extent to which they all carry more or less the same side effects. The one exception being caffeine. Caffeine's side effects